Medical records have both principal and ancillary functions. The principal functions being related to the encounters of patients with their healthcare providers. The ancillary functions being related to the environment to which healthcare services are provided. But the main purpose of the health record is still the same, regardless of the format, how it is processed, or how it is stored. This presentation will discuss the multiple formats available for the patient medical record. Medical records of patients are the same throughout an organization. They must include the same patient information, such as demographics, insurance information, diagnoses, procedures performed, treatment plans, and medications given, just to name a few. Medical records also perform the same function to document patient care, is a reference tool for caregivers as examples. This is true regardless of the format of the medical record. Medical records are available in three main forms: paper, electronic, and hybrid. We will discuss each in detail in the upcoming slides. Paper is, of course, the traditional format, where information is handwritten and kept in paper form. Electronic is what we refer to as an EHR, or electronic health record. This is where information is created and stored in a computer or electronic system. The last format is hybrid. This type of medical record is a combination of both paper and electronic. A majority of medical records are in the hybrid state. The textbook discusses three different ways a medical record can be organized or set up. They are source-oriented, problem-oriented, and integrated. Let's discuss each one briefly. Source-oriented records are set up by grouping similar information together. This means all physician notes are grouped together, all laboratory reports are grouped together, and all radiology reports are grouped together as examples. This format is also called the sectionalized record because it is divided into sections. Many facilities use this format since it is easy to locate documents. Problem-oriented records were actually developed in the 1960s to improve organization of the medical record. It typically consisted of four major components: database, problem list, initial plan, and progress notes. In the problem-oriented record, the patient is assigned problems, and the notes for each problem are documented in what we call the SOAP format or method, SOAP. The S is subjective. Patient symptoms and complaints are recorded here. The O stands for objective. This is where physician findings or test results of the patient are recorded. The A portion is the assessment, or the evaluation made by the health provider, or the diagnosis of the patient. P is the plan. That's what will resolve the problem of the patient or the treatment plan that's laid out by the physician. The SOAP method can be used in physician office notes or in hospital medical records. The integrated record is arranged in strict chronological or reverse chronological date order. This format allows for observation of how the patient is progressing and responding to treatment. Most progress notes in a hospital setting are integrated in the medical record. There are various limits on paper-based records. They do have to be arranged in a certain order. That makes it easier to find documentation that is placed in the record. It would be very difficult to go through hundreds of pages just to find one report. The chart order simplifies this process. A paper chart can only be reviewed by one person at a time in one location. Multiple users cannot look at a paper chart together. When several caregivers need to document, they must wait their turn. Paper records can sometimes be difficult to update. There are many forms and pages that make up a paper chart. Information can be misplaced, and many pages get added to the record after the patient's visit. Late entries can be documented in the medical record at any time. Entries sometimes have to be corrected in the record as well. The standard way to correct a medical record is to draw one line through the error, write the word error, rewrite the entry, along with signing and dating the correction that was made. Nothing is allowed to be completely crossed out so it cannot be read. You also, under no circumstances, can use correction fluid to correct an entry. Paper records are also very fragile. Papers can get torn, ripped, or get spills and liquid splatters on them. Regardless of what happens, the pages must be maintained. Slide number 5 lists the most formal definition of an electronic health record to date. It was determined by the National Institutes of Health during a study they did in their report on computer-based patient records. The definition on the slide has the word accessible italicized to bring out the meaning of the definition. Electronic records do not have the limitations of paper records. They are accessible to many users, sometimes even at the same time. They are more than just paper records being scanned into an electronic environment. An electronic record contains alerts, such as drug interactions, and reminders, such as prescription refills for healthcare providers. Advanced electronic medical record systems also support clinical decision-making and healthcare delivery. Statistical reports can easily be created for trending analysis. There are many advantages toward having an electronic health record, some of which are listed on this slide. Information is readily available and pulls up quickly and easily. Access can be given based on who needs access and what levels of access they need. Perhaps a manager needs higher level access than an office clerk or a unit secretary, for example. Multiple users can access the chart at the same time to complete documentation. Unlike the paper record, you do not have to wait your turn for access. Different levels of tasks can be performed quickly. Running of reports or transmitting information can be done in less time. In addition, an electronic record can be easily updated and maintained. We cannot mention the advantages without mentioning the disadvantages of the electronic medical record. The cost of purchasing and implementing an electronic record are tremendous. The system must be built and implemented into existing technology to be most effective. Customization may even be some additional costs. Training is also a cost to consider. Numerous vendors offer electronic medical record software for everything from physician offices to hospitals. There are costs associated with having them to be on site and provide training classes for employees. Another note about training, training is done on many levels depending on the access levels being given. There are some individuals who are not as computer savvy as others, so it may take them longer to train and learn the new system. Technical issues are another consideration for electronic systems. Backup systems must be put in place in the event the system goes down or becomes unavailable. Can you imagine a hospital having a power outage and not having access to medical records at all? It can happen, so it is best to prepare for it ahead of time. Like any electronic system, an electronic medical record will need to constantly have various upgrades in order to stay up with the latest technology. Technology is constantly changing each day. Existing systems present in a healthcare facility need to be compatible with an electronic medical record. It would be too costly to replace all systems all at the same time. Interfaces are built in order to have system integration and for the systems to work together. Most health records are organized based on the models on this slide. Centralized, where all information is stored in one system. Distributed, where information is stored in separate department systems, or as a hybrid of the two. The centralized system is built around a clinical data repository. This is a database that collects, captures, sorts, and processes all patient information. It also provides easy access to data in electronic or printed form to the patient's clinical history. There is also image processing and storage technology available that can be used in a healthcare facility. Radiology is an area that can combine text files with digital images. A radiologist can access images taken electronically and file their report of findings electronically as well. For other areas that use paper or handwritten documentation, high-speed digital scanners are used to scan the paper to incorporate it into electronic images. Data must be easily retrieved out of any type of medical record. This may be more of a challenge with paper records. You have to physically flip through a paper chart to retrieve information out of it. It tends to be a bit easier with electronic medical records. The goal overall with retrieval is for information to be gathered fast and secure, and for the information to be accurate and complete. Even with electronic records, there is not always standardized terminology when performing a text search. This issue is being worked on by various organizations. SNOMED is the one that will be adopted in the near future. Data capture needs to be performed at the point of care. This has always been a challenge in health organizations. Providers need to get into the habit of documenting right away and not coming back hours or even later to finish documentation. This also helps to prevent misdocumentation. Dictation and transcription are forms of data capture that are performed. They should also be completed at the point of care. Voice recognition technology converts the dictated words into typed text. This allows the provider to perform their own dictation and makes it easy on the transcriptionists that type the reports. Optical character readers are emerging technology that is also available. With this technology, handwritten notes are converted to digital data. There are many vendors that provide health information systems, but they are not standardized in any way. The systems do not always talk to each other. This slide lists some of the many organizations that are working toward data content standards for health information systems. Their full names are listed in the textbook. Standardization of health information systems is going to take many, many years to reach. There are many aspects of health information and documentation that need to be addressed to get there. This slide lists just a few of them: structure and content, functionality, technical, standardization of forms and views, standardization of acronyms, abbreviations, and symbols. Clinical decision support systems are a component of electronic medical record systems. They help health providers make decisions on treatment. Similar technology works the same way in a pharmacy. Patient allergies are entered into the pharmacy system when the patient is set up in the system. When a physician orders a medication that the patient is allergic to, a notification or red flag will show the pharmacist that the medication cannot be given to the patient due to allergy. This then prompts the pharmacist to notify the physician he or she must order another medication that is compatible with the patient. These same type decision support systems work in other departments, such as the laboratory. The hybrid record is a combination of both paper and electronic, as discussed earlier in the presentation. This means that both manual and electronic functions occur with this format. While the hybrid record makes it easier to transition to an electronic record, there are still some processes that need to be managed properly in order to get through the transition. For example, when migrating to an electronic medical record, the old paper files will still need to be managed or maintained as they previously were. The new electronic documentation will also need to be managed according to the new guidelines set forth in the EHR adoption. Medical records are stored in various formats. They are listed on this slide. It is not uncommon for healthcare facilities to have all three storage formats for their medical records. As they transitioned to each new system, they kept the previous format of the old records. The old records will eventually be destroyed when their period of retention expires per regulatory and facility guidelines. This last slide discusses the functions of the Health Information Management or HIM department in regards to patient medical records. Records undergo a constant review process to ensure their completeness and accuracy. Record reviews are performed on an ongoing basis concurrently while the patient is still present in the hospital or healthcare facility. The HIM department performs quantitative analysis to ensure each record contains the necessary components required. They can refer to the chart order discussed earlier in this presentation to help them. They will also look for missing signatures and forms in the medical record as part of this process. In qualitative analysis, they are auditing or reviewing charts for the quality of the documentation. This is a more detailed review. For example, they may audit a hospital inpatient discharge summary for all required items. The required items are obtained from various sources, such as accreditation agencies, regulatory agencies, facility bylaws, and facility rules and regulations. This concludes this presentation.